Okay, welcome. Today we're going to continue our video series, and we're talking with Kelly McMasters today, who's been the editor-in-chief of the Annals of Surgical Oncology for the last 6 years. Welcome, Dr. McMasters.
Thank you.
So we're going to go through just a few questions. Last year, there were nearly 5,000 total article submissions to ASO and 1,800 articles published. I'm trying to figure out, how exactly do you manage all of this?
The answer there is pretty easy, that I don't have to manage the actual processing of the manuscripts and peer review process, because that's done by Deb Whippen, our and the editorial staff, which does such a fantastic job, along with executive editor Dr. Mark Rowe, who do all of the peer review and processing of the manuscripts, along with the editorial board and the peer reviewers for the journal. And there are a lot of people who volunteer their time. In fact, to do all this, I estimate that it takes about 10,000 person hours of volunteer time per year to review and process all of those manuscripts. So it's an incredible amount of work.
You certainly have greatly improved the journal. Which changes are you most proud of, and which do you think have been the most effective?
So new things that we've done, for example, new features, new article types, like the landmark series of articles, reviewing the landmark evidence in each disease site that leads to the practice patterns that we have now and standards of care. ASO Perspectives editorial series, the ASO Research Communications short research report, a new category of articles, the Practice Guideline series, the Great Debate series, and now the Heroes and Legends series, where we're doing interviews, much like this one, with some of the true leaders who have helped develop the field of surgical oncology. I think one of the major contributions we've made is to make the editorial board nomination process more fair and equitable. Now it's a self-nomination process. We go through a lot of work to really make sure that everyone has an opportunity to apply for the editorial board. Video abstracts and now audio-visual abstracts, all these things are being pumped out nearly twice a day, every day on social media. As a result of this, we've really reached a truly global audience. We're now over 2 million downloads per year of Annals of Surgical Oncology articles. And all of this is the result of the work of all of the members of the Society of Surgical Oncology. It's really been an astounding effort, and I'm just proud to help try and steer it in the right direction.
My last question is, how do you think open access will affect the Annals of Surgical Oncology?
So Annals of Surgical Oncology is a hybrid journal. 10% of the articles in ASO are open access, which means 90% are in the traditional publishing model. And over time, we anticipate that open access, as more transformative agreements take place throughout the world, that there will be a greater proportion of open access, and eventually everything will be open access. The journal is positioned as a hybrid journal to be able to accommodate that transition over time. In fact, as you're well aware, the Society of Surgical Oncology has launched its own open access journal, Surgical Oncology Insight, which is off to an amazing start, and we're collaborating very much with the new journal in helping to assure that our new open access journal has plenty of content and ability to grow and prosper as well. So it's a good collaborative effort between the two journals.
Well, thanks again for all your efforts. Obviously, the Annals of Surgical Oncology is a vital part to our Society of Surgical Oncology, between the members participating at a high level within it, and then also some of the proceeds of the journal going back into the society. So thanks again. Keep up the great work. I hope you're able to do this for a long time.
Well, I hope I am too. It's really been a lot of fun, and thank you so much.